Good morning, everyone. We are very excited to present our project proposal to you guys this morning. This presentation is brought to you by Alexa, Taylor, Mackenzie, Ashley, and Danica. So thank you for watching.
So to start off, good morning to all our investors. Here at Billy Mates Incorporated, it is our mission to provide holistic care to all newborns with excessive bilirubin levels and to ensure moms and babies have the best experience possible. The attached proposal will outline the assessment, design, implementation, and management of our innovative design that can offer you vast improvements to your hospital. This device will also improve standards for discharge by providing a rental option for families in need to take those vests home. We are confident that our device is a perfect fit for managing the needs of your patients. Sincerely, the CEOs of Billy Mates Incorporated.
So today we will be going over our project context, the device solution, the project timeline, integrating the Billy Vest, and patient testimonials.
So what is jaundice? Jaundice is yellowish tinted skin from elevated bilirubin levels, which is a byproduct produced by the liver. What is hyperbilirubinemia? This constitutes as elevated levels of bilirubin in the neonate's blood. This commonly occurs in newborns as their metabolisms break things down and produce bilirubin faster in the first few days of life. How do Billy lights help? Phototherapy using Billy lights can break down the bilirubin in neonate's blood via photooxidation, which essentially adds more oxygen to the bilirubin so that it can better be dissolved in the body.
So you're probably wondering, how exactly does this affect you? Well, 6 out of every 10 babies are born with jaundice, and 8 out of every 10 premature babies are born with jaundice. 1 out of every 20 babies will require treatment for elevated bilirubins and complications from jaundice. So that is a lot of babies out there who experience jaundice and elevated bilirubin levels. And those are a lot of patients in your network who will experience this. Currently, when babies are born, their bilirubin levels are assessed, and if their levels are too elevated, then the baby goes to the NICU. If the baby's levels are just slightly elevated, then the patient can receive treatment from bilirubin lights in their mother's hospital room. They need to be under the bilirubin lights to treat the jaundice, but this does not promote skin-to-skin with mom, which is a crucial step in bonding. With our solution, moms and babies can bond more effectively, which reduces stress on both mom and baby, and can lead to shorter hospital stays from that reduced stress.
The Billy Vest is an adjustable Velcro vest that's infused with UV light to aid in the treatment of hyperbilirubinemia. The vest can be adjusted to fit the needs of each neonate individually, and it can also be used in conjunction with a swaddle technique to cover more surface area if needed. In instances where the newborn needs prolonged treatment, there is a rental option where the families can take the vest home with them for the duration of that treatment. This would include the vest itself, the adapting hose, the electrical outlet connection, and then a carrying case as well. This allows for fast and efficient discharge and then encouraged early acclimation of the newborn to the home environment.
So we currently have a supplier who is willing to outsource the production of our Billy vests, and they will be supplied through a company in China. We are currently projected to have 25,000 units produced and ready to ship by September 15th, and the next shipment will also be 25,000, and this can be produced and ready to ship by December 15th. So we are expecting to have a total of 50,000 units produced and on their way to us by the end of the year. And currently with our supplier, the cost per unit for the hospital would be $2,499. So we have been working with 2 of the major EHR companies, and those are Cerner and Epic, to create a new specific spot in the patient's EHR for documenting the use of the Billy Vest. We have completed the testing phase and are currently implementing this new charting section for when the units are ready to begin testing. And we're doing this at the very famous PMI hospital, which is very well known for trying new products and testing new technology before it is set to the wider scale. So here's what the charting would look like. The charting is going to include a pre and post treatment documentation. This is just going to include things such as labs, vitals, and also a general assessment of the baby. as well as how treatment was tolerated by the infant and whether or not it was effective and safe.
So how does the Billy Vest create more profit for you? Well, the vest can decrease hospital stays, which means we can have more rooms available for other patients. It also means that there are less opportunities for patients to acquire hospital-acquired infections because they will be less exposed. The Billy Vest can also increase patient outcomes. When mom and baby are able to bond and experience less stress while baby is being treated for jaundice, then we are truly providing holistic care to our patients. We allow more opportunity for the baby's parents to be involved, giving our patients more autonomy over their care. With our new innovative equipment that can easily be used at home, we are creating more profit and revenue with the price of the equipment rental while still keeping rooms available for other patients. The hospital will still be receiving funds without the patient even being in the hospital. The vest will also increase the HCAP scores, which will directly demonstrate our increased patient satisfaction. This can open up awards possibilities for the hospital. Lastly, word travels fast among new moms, especially on social media, and we want people to be talking about how your hospital uses innovative technology to improve patient outcome and care, because the new moms will be more likely to choose your hospital. Here are some of our patient testimonials.